Welcome to the 2025 Member Benefit Session video. We're so happy you're a member. This video will cover some highlights of the great advantages you have by being a Health First Health Plans member. Make sure after the presentation you fill out the survey attestation to receive your $10 gift card in the mail. First, we're excited to announce that not only are we continuing to offer Health First SunSaver HMO, but we are introducing a new plan, the Health First Easy Access HMO POS plan this year. You'll hear more about that later. Your wellness will continue to be enhanced by the Advent Health network of providers, facilities, and hospitals. Our extended network stretches across 10 counties in Florida, giving Health First Health Plan's Medicare Advantage members access to more than 4,000 providers. Advent Health hospitals, facilities, and providers lists can be found in the provider directory online at hf.org/directory. Advent Health Hospitals in Network. Other hospitals in network. Here's just a couple of reminders about the great benefits you have in 2025. New HMO POS plan with out-of-network benefits. $0 premium plan and primary care copay. Supplemental benefits, including dental, vision, hearing, and OTC benefits. More than 150 prescription drugs at $0 copay. No referrals to see a specialist. More than 4,000 providers across 9 counties in Central Florida. Worldwide urgent and emergency care. $0 gym benefit. Non-emergency transportation. And we're still your local community health plan, located right here in Central Florida. Health First SunSaver HMO benefit changes. We've made some great changes to your benefits for 2025. First, we have increased your over-the-counter OTC amount to $130 per quarter. That's an additional $70 per quarter. Additionally, for our Health First SunSaver HMO benefits, we've reduced copays in the following fields. Skilled nursing facility, reduced from $180 to $150 for days 21 through 100. Days 1 through 20 are $0. Specialist decreased from $35 to $20. Podiatry decreased from $35 to $20. Telehealth reduced from $0 to $35 to $0 to $25. Diagnostic radiology, MRIs, and CT scans reduced from $150 to $100. Ambulatory surgical center reduced from $0 to $150 to $0 to $75. Hearing aid allowances have increased to $1,000 every 2 years. There's been a few increases as well, with the following benefits having a small increase in cost share. Emergency room copay increased from $110 to $140. Worldwide emergency and urgent care copays increased from $110 to $140. Mental health copay increased from $0 to $20. Psychiatrist increased from $0 to $20. Opioid treatment increased from $0 to $20. Therapeutic radiology increased from $0 to a 20% coinsurance. Diabetic supplies increased to 20%, but only applies to non-preferred manufacturers. Preferred manufacturers are still 10%. Worldwide emergency room and urgent care services outside of the U.S. are now capped at a $50,000 annual limit. This is only for emergency and urgent care services outside the United States. 30-day pharmacy on Tier 3 and 4 have some slight changes. You can see in the chart. New this year, we are offering the Health First Easy Access HMO POS plan. That includes HMO POS plan with out-of-network benefits, $0 premium and primary care copay. No referral is required to see a specialist. More than 150 prescription drugs with $0 copay. Includes dental, vision, hearing, and OTC. 2025 pharmacy changes. Standard Part D out-of-pocket cost. Your annual deductible will be $0 for Health First SunSaver HMO plan members, and the Health First Easy Access HMO POS plan has a deductible of $200 on tiers 3, 4, and 5. Initial coverage phase. Cost share tiers apply, $0 to 33%. Coverage gap. The coverage gap or donut hole will be eliminated on January 1st, 2025. Catastrophic phase. Starting January 1st, 2025, the initial coverage phase is reduced from $8,000 to $2,000. After you reach your maximum out-of-pocket of $2,000, you pay $0 copays for the remainder of the year while in the catastrophic phase. Payment plan option. Beginning in 2025, the prescription drug law known as the Inflation Reduction Act requires all Medicare prescription drug plans to offer the option to pay out-of-pocket prescription drug costs in the form of capped monthly payments instead of all at once at the pharmacy. We've updated the $0 copay list, Tier 1, and we now offer generic medication options for all of the following: asthma, lowering cholesterol, reducing blood pressure, managing cardiovascular disease, diabetes and blood sugar control, treatment of depression, antibiotics for infections, anti-cancer drugs, antipsychotics, antiarrhythmics, gastric reflux, treatment of benign prostatic hyperplasia. Novolin RN and 70/30 insulins are also Tier 1 with $0 copays for 2025. $35 copay for a 30-day supply of all other insulins. Includes insulin delivered via insulin pump. Novolin RN and 70/30 insulins are Tier 1 with $0 copay. $0 copay for Part D vaccines, including the following: hepatitis A, hepatitis B, Japanese encephalitis virus, HPV, rabies, tick-borne encephalitis, yellow fever, shingles, MMR, HIB, meningitis, typhoid, tetanus, pertussis, diphtheria toxoid, varicella. For the most current list of in-network pharmacies, visit hf.org/directory and select Medicare Advantage plans for a directory link. 2025 Preferred Pharmacy Network. Within our Medicare Preferred Pharmacy Retail Network, you also have access to preferred pharmacies where your prescriptions can be filled at a lower cost. Supplemental Benefit Overview. Transportation. We want to ensure that you have transportation to any health-related appointment scheduled, such as provider office visits, pharmacy, physical therapy, labs, and more. You have up to 24 to 32 one-way trips, depending on your plan per year. Each trip is up to 75 miles. You can schedule same-day rides by calling our customer service department, or do it yourself by using the Roundtrip app or roundtriphealth.com/healthfirst. To aid in your recovery from an acute inpatient stay, you can receive up to 1 week of meals delivered to your home once you are discharged. A week of meals is the equivalent of 2 meals per day for 7 days, for a total of 14 meals. The nutrient-rich meals are designed to speed up healing and get you back on your feet. If you qualify, a GA Foods representative will contact you to start your free meal delivery service. On the first day of each quarter, January, April, July, October, you receive an allowance of $115 to $130, depending on the plan, added to your prepaid Visa card automatically. Medicines such as cold and allergy medicine, vitamins, first aid essentials, and pain relievers are included. Participating retailers include CVS, Walmart, Walgreens, Family Dollar, Dollar General, and Rite Aid. Your allowance does not roll over and will expire at the end of the quarter. Be sure to use it before the 3 months are over. Receive an email copy of the OTC catalog by calling 1-800-716-7737 or visiting athome.medline.com/card. Conversations with your provider. This year, we also want to give you some tips on communicating with your provider. Here are some important topics to discuss with your provider to help you get the best care possible. Medications. Do you experience any side effects or barriers to taking your medications? Specialty care. Is your primary care provider aware of all the specialty care you are receiving? Falls. Have you fallen recently, or do you have issues with balance? Physical activity. Are you getting an adequate amount of exercise? Bladder control. Are you experiencing any bladder control issues? These are some typical questions that might slip your mind when you get to your appointment, but are important when it comes to maintaining your wellness. Also, take control of your health. Here are a few tips to help. Speak up. Bring a list of questions with you to your provider visit. If you are confused by the information they give you, let them know. Monitor your health. Don't ignore changes in your health. Telling your provider sooner can help you get the care you need. Appointments and medications. Keeping track of your medications and appointments helps answer questions about your health history. This helps providers know how to treat you. Stay educated. Ask questions about your lab results and your conditions. Understanding what is going on with your body will help you take care of yourself. Set your goals. Talk with your provider and set wellness goals. Focus on ways you can improve your mental, physical, and nutritional health. Some of the most important steps you can take in your wellness journey are your preventive screenings. These screenings are used to look for disease before symptoms are present. Talk with your provider to determine which screenings and vaccines are best for you. Here's a list of common screenings and vaccines. Vaccines. Remember, your provider is here to support you in all your healthcare needs. We've added even more information online for our members to use as resources. To navigate to the member resources, visit hf.org/yourhealth and click on Member Resources. Scrolling down, you will see Wellness Resources, along with a variety of category names. You can browse the categories for more information that you might find useful or informative. Documents here that you can download include Achieving Bladder Control, Colorectal Cancer Screening, Steps to Manage Your Diabetes, Balance and Fall Protection, Fall Prevention Exercises, Medication Therapy Management Program, Your Mental Health. Thank you for being a Health First Health Plans member. We're glad you chose us to be with you on your wellness journey. Please don't forget to complete the survey attestation to get your $10 gift card. Thank you so much for watching this presentation. We hope you've enjoyed it.